confirmed cases are trending down, many of our hospitals are still overwhelmed. Our Claudia Rupsich spoke to an emergency room doctor at Valleywise Health, and he says that the long wait times and a lack of rapid COVID tests have really been the major challenges here.
Dr. Mortaza Akhtar is an assistant professor at the University of Arizona College of Medicine, Phoenix, and an ER doctor at Valleywise Health.
The issue that we're having currently is that admits can take a long time.
He says people in the ER are waiting several hours, sometimes even more than 24 hours to be admitted and get a bed.
Even if the cases are sort of plateauing, that doesn't mean that people are necessarily being discharged very rapidly. And so a lot of the people, especially the sickest ones, are staying for long periods of time in the hospital.
Dr. Akhtar says it's especially challenging for Valleywise because the public hospital commonly serves vulnerable patients.
If you're uninsured, and in particular, if you're an undocumented migrant, you'll feel like there's nobody else you can go. You come to us or that's it. And so what will happen is if our ER gets backed up or delayed, or our hospital is delayed, people will sometimes go home without being seen.
Dr. Akhtar says one of his patients was sick with the coronavirus and had heart failure. She'd been waiting for so long, she decided to go home to her family.
And we were like, listen, you're pretty sick. We think you need to come to the hospital. And she said, listen, I think I'm going to die. I would rather die at home than at the hospital.
This week, the hospital ran out of rapid COVID-19 tests. They now have to wait up to a day to get results back.
But a day is a long time if you're in the emergency department. If I have a patient, I need to admit him or her, I need to know within a couple hours which unit to send him or her to.
Dr. Akhtar says recent state case numbers are encouraging, but people still need to do their part with masks and social distancing.
I'm optimistic that the numbers are getting better, and I hope they'll continue to. But I'm a little bit pessimistic as to how people will view those data. And I feel like if they let loose, we're going to go back to where we started, which we don't want.
In Phoenix, Claudia Rupsich, ABC 15 Arizona.